Hi everybody, I'm Dr. Kimber. I'm excited to be here with you today. Today we're going to talk about something that virtually affects everyone, and that is stress and its connection to chronic illness. Now, raise your hand if you do not have stress. No, I'm just kidding. We all have stress. It's just how we are dealing with this stress and whether or not we can allow the stress to come into our body and then flow out of us. We can't avoid stress. It's just when we hold on to it, when we allow it to be a chronic situation, that's when we find that we have major issues. And so we're going to kind of dive into it today. And I really want to draw out for you the concept of what happens when you have this stress in your life and it is undealt with, and you just continue to live in a stressful situation. How it affects our bodies, how it sets us up for infection, and then really affects us physically and many other areas. All right, so let's define clinically what stress is so that we're all on the same page. Clinically, stress is defined as the body's response to physical, mental, and emotional pressure. Physical, mental, and emotional pressure. It actually causes chemical changes within the body that raises the blood pressure, it raises the heart rate, it changes the blood sugar levels, and it potentially then leads to mood fluctuations, things like frustration, anxiety, anger, or depression. All right, so that is a clinical definition of what stress is. Now, what happens to our brain when we are stressed? Your brain is not capable of differentiating between physical stress and psychological stress. So every single amount of stress that is perceived in the body by the brain is equal, whether it's a bad night of sleep or a car accident. They are perceived in the brain as equal. So we can understand just from that statement why sometimes it's a little bit more difficult then to get ourselves or walk ourselves out of a chronic stress situation, because we first kind of have to identify it and come to terms with where that stress is at. So maybe it's poor sleep habits, maybe it's poor nutrition habits, maybe it is in a terrible work environment, whatever that is. So it's interesting to me because statistics will actually tell us that 70 to 80% of all doctor visits are for stress-related illness. Wow, right? 70 to 80% of all doctor visits are actually for stress-related illnesses. I think that's phenomenal. And so what would happen to us if we found that our bodies were able to deal with this stress better? We would then not have as much need to go to the doctor. Our doctor visits would become less. Doctors would start seeing less people because we were able to identify that stress, work through that stress, and help our bodies to calm and be out of that high stress situation. It's also believed that people who have high anxiety are 4 to 5 times more likely to have a fatal heart attack. So if that's not enough to help you identify where your stress is coming from, I don't know what is. Also, about half of all illnesses, and I kind of stated this already, but I'm going to state it a little different, about half of all illnesses are stress related. So are you dealing with that chronic illness? Is there some sort of chronic situation that you have with your health that you've not been able to overcome? This talk just might be for you. Today's talk just might be for you. All right, I'd love to hear where you're listening from. So if you wouldn't mind going ahead and putting down where you're listening from, and then you can even let me know. Are you stressed or are you not stressed? What's your secret to walking yourself through a stressful situation? It's not impossible, and we're going to talk about some things at the end today. Let's again, though, identify the 4 types of stress. So first we have physical stress. Now, physical stress is stress like trauma, environmental pollution, illness, sleep deprivation, nutrient deficiencies. So those are all physical types of stress. Then we have psychological stress. So our number 2 is psychological stress. Psychological stress is like emotional stress. So like fear, frustration, grief. And then you also have cognitive stress, which is under psychological stress. And that can be things like worry or anxiety or panic, right? So that all fits under psychological stress. Then our 3rd type of stress is social stress. Now, social stress is relationship difficulties, job difficulties, isolation. We saw a lot of this when things were shut down in 2020 for the pandemic. So isolation can be one of those social stresses as well. But asking yourself about your job situation, your relationship situation. And then the 4th type of stress is actually spiritual stress. So it's when you are in a crisis of values, when you have no meaning to your life, when you feel as though you have no purpose with your life. As a believer, if you feel or are going against God's will for your life, those can cause different types of stress as well. So those are our 4 different types of stresses that we really want to be aware of, because a lot of times we think of stress as just one thing, one category, but it really can come from various different categories. So I want to pause a minute and I just want to say hi to Ellie from Iowa. I want to say hi to Marie from Sussex, New Brunswick, and I want to say hi to Pam from Boston. It's great to have you all with me today. So let me know, how are you doing with stress? Are you struggling with stress? Maybe that's why you're on. Or do you have a trick to walk yourself through stressful situations? Okay, so let's talk about what happens in the body when the body is perceiving a stress response. The very first thing we encounter with stress is that our body activates the sympathetic nervous system, which is our fight and flight response. Think of it like your body responding as if a bear were chasing you in the woods, right? So keep that in mind. This would trigger your heart rate to increase. It's also going to trigger your blood vessels to constrict and redirect the blood flow to vital organs, things like your heart, right? Your heart needs to speed up. Your lungs need to have more capacity. It's also going to trigger some sweating, and most importantly, it is going to decrease your digestive activities. Okay, so that's important because you don't want to have to be stopping to go to the bathroom when that bear is chasing you. So there are some physical things that change in a stressful situation. Now, don't walk away too far from the stress we just talked about, the 4 different types of stress: relationship, worry, lack of sleep, nutrition deficiency. And then also don't walk too far away from what we just talked about, that the brain cannot differentiate. So we're starting to draw a picture of why when there's a stressful, undealt with stressful situations, you can experience chronic illness. All right. Now, this response that the body goes through is actually very normal. And it is what our body does in an acute situation. Again, the problem comes in when we live in a chronic situation, a chronic stressful situation. So when stress becomes chronic, the body starts to talk to us. And then it's going to manifest in different symptoms. Some of those different symptoms might be things like headaches or heart palpitations or constricted breathing, difficulty breathing, or fatigue or anxiety or allergies or asthma even. These are all various different ways that the body can respond and start talking to you through symptoms. All right, so ask yourself, where are these symptoms coming from? If I have a headache, I'm going to stop, I'm going to pause, and I'm going to ask myself, what is causing this headache? I'm going to do that before I run and get something to take the headache away, because then I won't think about it again. I have a headache. What's causing the headache? I start to go through a symptom checker. Well, am I feeling stressed? What could be causing me to feel stressed? All right, so that's a really good exercise when you have these symptoms. Don't just stuff them away with a medication. Actually ask yourself what could be causing this. What is leading to this? And then, a one-off headache. All right, we all get one-off headaches, but it's the consistent chronic headaches that we need to be aware of and stop and pause and ask, what is my body trying to tell me? All right, I want to share with you a story about a patient we're going to call Amanda. Obviously, I've made up her name, so nothing is shared here that is confidential. And Amanda is a 42-year-old woman who came to see me after she had been struggling for years with fatigue, unexplained weight gain. Even though she was eating well, she just kept continuing to gain weight. She had chronic bloating. She had a lot of brain fog and a lot of poor sleep. When we first met, I asked her for a thorough history, and Amanda told me that she was a very overachieving executive who prided herself on pushing through in stressful situations. She worked 60 or more hours a week. She also prided herself in the fact that she was able to care for her aging parent as well as a family, husband and children. Can you see where we might have some chronic, continual, stressful situation going on? She, like most of my patients, came to me after she had seen a lot of different doctors and who ran a ton of different tests, and all of the tests came back normal. We're going to put quotes around that. There was nothing significant. So I went ahead and ran a few other tests, functional tests that helped me to see a little bigger picture, things like a hormone test so I can see where the chronic or see what her cortisol was like. And what we found is that her cortisol patterns were all over the board. So her cortisol was very high. She also was very low in her hormones, which really correlated well with a lot of the hormone issues that she was having, like weight gain, difficulty sleeping. And we also took a look at her digestive function, and we saw that her elastase was very low, and so she was not breaking down her foods in the proper way, so she was probably living somewhat malnourished as well. Basically, her body was in a constant state of fight and flight, and it was never getting a chance to rest and repair. And this is a perfect example of how chronic stress and just pushing through and really looking at these superhuman challenges that we continually put on ourselves to solve are really not healthy for us and really breaking us down. Now, needless to say, making some major lifestyle changes helped her a ton. Using some really targeted supplements for a while because her body wasn't capable of doing it helped her a ton, and changing just her lifestyle pattern and how she handled stress helped her a ton. And so she is actually doing much better these days. So that's a typical story of patients who come to me, and the root cause being just chronic stress. So after we can identify that and learn how to work through that, we have a lot of results that happen in a very positive way. I want to say hello to Hilda, listening from Puerto Rico. Wonderful to have you. All right, so let's dive a little bit deeper into what happens to our digestive system when we are in this chronic state of stress. First of all, when we're stressed, our body thinks that it needs to focus the blood flow all around the heart and the lungs and our muscles in order to run from danger. Heart, lungs, muscles, right? Nothing's going on in the gut. It limits then the blood flow to the digestive system. And so everything slows down in the digestive system. I mean, again, we don't care about eating and digesting when we're trying to outrun a bear, correct? Correct. All right. Then what happens is because of this lack of blood flow, we then end up having poor breakdown of food in our gut, and we have a reduced nutrient absorption in that gut, and ultimately leading to nutritional deficiencies. So that can affect things like sleep, fatigue, energy, all of that. Your body is starving. Okay, so then what happens? Like I said, we start to get symptoms. So we have symptoms of brain fog, of lethargy, some have symptoms of reproduction, not able to reproduce, so infertility. Menstrual cycles can change for us women. Gut infections can increase, and just basic decrease in immune function. So you start to get sick more often. Maybe things that are going around in the family or in the office, you start to catch them more often. So, Hippocrates said it well, and I think it's worth saying again, and that is all disease begins in the gut. And that is very true. Everything comes or stems from the gut. So our overall the health of our digestive system really determines the health of our entire body. So when we have stress, and that stress is affecting that digestive system, it makes sense then that it's going to affect the entire body. Would we all agree? Put a thumbs up in the emoji if you agree. All right. Just to know that I'm not alone on here. I'm hoping that you're following me here. So these are important things to remember. Now, what happens, another thing that can happen is when we have a weakened digestive system, we set ourselves up for chronic infection. One of those things is parasites. Parasites are not an issue if you have a healthy digestive system. They become an issue when your digestive system is not healthy. So those are things that we need to remember, because those parasites are going to do things in your body, like they're going to weaken your immune system. They're going to cause disruption in the gut microbiome. They're going to interfere with your neurotransmitter production. So how you think, anxiety, depression, how you feel, those things. So an interesting study in 2017 found that there is a common connection amongst patients in psychiatric facilities, and that is that they all had common parasitic infections. That's kind of interesting, wouldn't you say? I think so. Okay, so sometimes we sit there and we think to ourselves, I don't know, I don't feel stressed. Like, I'm checking in, I love my job, I love my husband, I love my family, things seem okay, but my body seems to be telling me a different story. So let's look at some of those clues from your body. Your body is constantly communicating with you. I find that fascinating. When I was going through naturopathic school, I took a course in how to read the body and the symptoms of the body. So I mean like looking at the body. So the hairline, the where the weight is generated, down to the color of the eyes and the way the eyes look, the pupils of your eyes and whatnot. So it's very fascinating to see how the body actually talks to you. Maybe sometime I'll do a live just on that because it really is interesting and kind of captivating. But one of the ways that your body will tell you that there is a digestive issue is through things like your liver, for instance. When your liver is not working properly, a very common sign of that can be itchy skin. Another thing that we can see when the liver is not working properly is a hormonal dysfunction, and that is that we begin to get estrogen dominance. Guess where estrogen likes to show that it is increasing in the body? That's right, in the breasts, in the hips, and the thighs. Now these are all, they trace all the way back to chronic stress situations. Another physical sign of a chronic stress situation is premature graying. So are you prematurely getting gray hair? It can be a very good indicator that your body is under a high stressed situation. Now remember, you may love your life. You may love your job, your husband, your children, your home. Everything may be fine, but there can be a chronic stress situation going on because you have an underlying infection. That's one of the things that we talked about, correct? One of the 4 that we talked about, the physical type of stress. There's other ways as well. So you see, when we get stressed, our thyroid can get out of balance. And one of the ways to tell if our thyroid is out of balance is look at the widow's peak. Are you getting or losing hair in the widow's peak, or are you losing hair on the outside of your eyebrows? So what many people don't realize is that chronic stress suppresses thyroid function, particularly when it comes to converting T4 into T3. T3 is your active thyroid hormone. It's what helps your metabolic rate to stay strong, helps you to burn calories, burn energy. If you're constantly stressed, your body is going to prioritize the cortisol production over your thyroid production, so your thyroid then becomes compromised. And that's where we can see it in the eyebrows and in the widow's peak. Okay, so those are clues. They aren't end-all clues. There's other things that we look at when it comes to the thyroid. But if you're noticing that, then I would stop and assess where of the 4 types of stress could you be experiencing chronic stress. Another link that I commonly see is with gluten sensitivity. Why gluten? Where's the connection between gluten and stress? Well, the connection is that chronic stress damages the intestinal lining, creating this increased intestinal permeability. It's also called leaky gut. That's the term you might hear out there, is leaky gut. What happens then is it makes you more reactive to proteins like gluten. The more stressed you are, the more inflammation you receive from these foods, and it creates this vicious cycle. So you get more inflammation from foods because you're more stressed. One of the ways to maybe assess that you have gluten sensitivity is a large forehead. Okay, so a large forehead is one of those clues on the body. It's not an end all, but it's a clue that there could be something going on. There could, in the gut, intestinal permeability, maybe some gluten sensitivity going on. Peggy's agreeing, I see that. Then the other thing I want to talk about that is very common that I see a lot with stress, I already mentioned it a little bit earlier, is the liver. The liver, when we're chronically stressed, your liver becomes overburdened. It's trying to clear excess hormones. It's trying to clear medication, because when you're stressed, oftentimes you take more painkillers because you might have a headache or you might have body ache. All of those things, it's trying to clear. So it's taxed a little bit more, and so it becomes sluggish. And one of the ways that we can tell on the body when the liver is sluggish, I mentioned the itchy skin. That's a way that you can tell that the liver is sluggish. Another really good way is forehead acne. So you see, just by looking at you, oftentimes I can assess what your body is telling me based on the external look of your body. Now, that's not to say that I'm judging. I'm just trying to learn about you and put your story together and your clues to help you and to understand which part of your body is your highest priority and what is going on. So, as we kind of draw this time to an end, let's talk about a few things that we can do to help us walk through this stress and not live in this. And the first thing I'm going to say is acknowledge your stress. Become aware of your stressors, especially things like negative self-talk. Like that's a really good clue that you are stressed, is if you have to talk negatively to yourself about yourself, or if you are a person who is putting down other people in order to put yourself up. If that is you, you're probably living in a chronic situation. Take a look. Is it physical, mental, spiritual, social? What does it look like? All right, where's that stress coming from? Next, listen to your body. Pay attention to your symptoms. I listed off a few of them. What is your body telling you? Then, the third thing we do is we address the root causes. This is where I come in and I can help you. We can work together to find out what that root cause is. If you come to me and say, I have great social surroundings, I have great relational surroundings, I have great spiritual surroundings, we might take a look at the physical and ask, do you have a parasitic infection going on? Do you have a virus going on that is trapped in the body that is really taxing the body and causing that body to be stressed? Is there an imbalance in your hormone pathway? Is your thyroid off? Is your estrogen, progesterone out of whack? Those are all things that cause that chronic stress. And then one of the things I would really encourage is really create boundaries around stressful exposures. It's not like if your family causes you to be stressed, it's not like you can avoid them altogether. Maybe that's not the healthiest thing to do, but to create boundaries with it. I'm going to give you, extended family, I'm going to give you X amount of time, this many times a year or a month or a week, and I'm going to put some boundaries around that. And then when you walk away, simple little things like doing this or doing deep breathing during the time and after the time. A really good one is called 4-7-8. You breathe in for 4 seconds, you hold it for 7 seconds, and you exhale for 8 seconds. 4-7-8. If you're in a stressful work environment but you have no choice, this is where you are called right now. Then breathing 4-7-8, doing that multiple times a day is going to help to calm your body down. Be mindful of the stressful situation you're in all throughout the day so that your body knows it has a trust factor between the psyche and the body, that you're in this stressful situation and you're doing things like breathing to help the body cope. Gentle movement. taking walks during your lunch break, getting up and moving. That's important for your body. Getting good sleep. Prioritize your sleep. These are all things that are going to help your body to cope with the stressful situation that you might be in. Again, if you are struggling, if you are not sure what's causing this chronic situation, or you've gotten yourself into a situation you can't get out of, reach out. I'll put a link in there that you can click on and set up a call so that we can discuss what it could be for you. Now, in closing, I'm going to pop up a screen, and I did a diagram of everything that I've talked about today, because I know for some of you, you're a virtual learner. And so in that first box, we see chronic stress. That chronic stress, like we talked about, is physical, spiritual, social, mental, those types of stressful situations. What that does is it leads your body to remain in a fight or flight situation. So your digestive function becomes compromised, your cortisol production becomes elevated, your blood sugar changes, all of that. What that does is it leads to gut disruption. So you become malnourished, you have poor digestion, you become a perfect place for parasites to inhabit or infections to inhabit, things like that. If you drop down to the next box, that is all about the consequences then that we're experiencing because of that chronic stress. We're experiencing those nutritional deficiencies. We're experiencing the parasites. We're experiencing toxin accumulation because your body is not getting rid of it. It is incapable of getting rid of it because the gut is so disturbed. Which leads us into chronic illness. And that chronic illness then is where I meet you. It's when you're fatigued all the time. It's when you have anxiety and depression and weight gain and hormonal imbalances and autoimmune issues just keep creeping in and brain fog, and you just don't feel like yourself anymore. But there is hope, and the hope is that you can break the cycle. You can acknowledge the stress and where it's coming from. You'll listen to what your body is telling you and all the signals. You address the root causes, and then you manage that stress input and output. There is hope, my friends. Let me know if you need help. I'm here for you. Have a great week, everybody. See you next Wednesday.